India's largest news network.
Hello friends, today we are going to talk about the most commonly diagnosed neurodevelopmental disorder in children all around the world, ADHD, Attention Deficit Hyperactivity Disorder. ADHD is the most common problem which is faced by a lot of parents because when they realize their child is doing wonderfully in other activities but is lagging behind in studies, the poor performance is linked to ADHD. So to discuss this, we have with us globally renowned doctor, Dr. Philip John. Dr. John is working as a senior consultant, psychiatrist at Peejays Neurocenter, Cochin, Kerala, and the Child Guidance Center, Sharjah, UAE. Dr. Philip John is a postgraduate from NIMHANS, the National Institute of Mental Health and Neurosciences, a premier institute of psychiatry and neuroscience in Asia. Dr. John has been practicing psychiatry for over 40 years now. He is globally renowned for his work amongst the medical fraternity and he has trained many doctors worldwide. Welcome, Dr. Philip John. Thank you for taking some time out for us.
The honor is mine, certainly.
So, Dr. John, before we get on to the questions, you know, in today's world, poor school performance by children in school is usually linked to ADHD. So, could you explain to us what exactly is ADHD?
Two things. One is about poor school performance. There are at least 6 or 7 reasons why children do poorly in class. Not just ADHD, but it is very important and significant and substantial that, you know, ADHD is the most common reason why children do poorly in school.
Okay.
It is also the reason why parents realize that, you know, the child is good in everything except studies.
True.
And that is the need actually for us to have a discussion like this. What is ADHD? ADHD truly is attention deficit. There is a deficit of attention and concentration in the child.
Okay.
And hyperactivity.
Okay.
Many of these children with ADHD are hyperactive. They are unable to sit at a place to substantially throw attention and concentration to a reading learning task for an adequate period of time to be able to learn the task.
Okay.
They are unable to do that.
Okay.
And when they are unable to sustain attention, they have a difficulty in learning. The learning itself gets affected.
Okay.
But in all other areas of functioning, other than this learning process, they are good.
Okay.
And that's why there is poor school performance, but they are good in everything else.
Everything else.
When I say neurodevelopmental disorders, it implicates a certain amount of lack of development of the brain and some influence from the environment where the child grows up.
Okay.
So there are 2 reasons why these children do not develop their ability to sustain attention to an ongoing learning task. One is, of course, the development where during the child's early growth, the brain cells which are in charge of controlling attention and concentration, those brain cells do not develop adequately.
Okay.
They instead connect differentially, and therefore the connectivity across brain areas which should handle the same function. There are various areas in the brain which should connect together to be able to put out a single function like attention or concentration.
Okay.
So that connectivity does not occur because is lacking because of the lack of connectivity.
So how do we identify these children? What are the symptoms? And more importantly, who identifies the children?
It has to be identified by somebody who is trained temperamentally as well as academically to pick this up.
Yes.
The World Health Organization has an international classification of diseases.
Okay.
It is called ICD. According to ICD, each disease has a block. F block belongs to psychiatry.
Okay.
G block, for example, belongs to neurology.
Yes.
F block is what actually ADHD comprises of. In F block, F90 is what ADHD is.
Okay.
Which means what? There are psychiatrists who are trained to look after, to diagnose and to treat these disorders.
Okay.
The other is what are the symptoms. So there are 2 clusters to these symptoms. One set of symptoms, they relate to the quiet child. The child is quiet, but child has no attention. Child has a wandering mind.
Okay.
Child sits at a place, opens his books, but he's not there.
Absorbing.
A little noise outside, he gets distracted. Somebody talks outside, he distracted. A little noise in the kitchen, he wants to go and see what mama is making for him today.
Okay.
Or he gets thoughts of what the teacher said or what the other friend said. So he gets distracted. There is a difficulty for him to sustain attention to ongoing learning task.
All right.
Whereas these children are very good with respect to any other task. You give him a computer, you give him a mobile phone, you give him a video game. He's absolutely
and
good.
Do very well.
Music or art or painting, they are very good.
Okay.
Because they are all functions that are related to another part of the brain. Today, as I said before, we know that the brain controls all these functions from various different areas in the brain, and they are controlled by various neurochemicals which work together in tandem to produce the output.
Okay.
This doesn't happen with respect to the reading learning tasks that these children have to do as they get on with their studies. So that is one of the aspects of this lack of attention and concentration. The other group is the hyperactive group, because they are unable to sit at a place. I am a reformed ADHD child. It's very difficult for me to sit at a place. So these children are unable to sit at a place to continue to sustain attention to an ongoing learning task again. But they are restless, they are fidgety, they tap their fingers on the, or they shake their legs, even adults do. So we see many of them in society where we can see their restlessness and fidgetiness and squirminess. These children are easily picked out. But you look at the other side is the quiet children who are not hyper, who are not blurting out answers, who are not impulsive, who are not butting into conversations. That is the other group, hyperactive group. They butt into conversation. When guests come home, they will not allow the ladies to talk. They should be the ones talking. The child butts into their conversation. He's waiting for in the queue to get into the school bus. He'll run across the other children who are waiting and get into the bus. The teacher asks a question, even before the answer is called for, he will answer that question. So basically, they are unable to sustain the ability to sustain impulse. So these are difficulties that they have when you look at children with ADHD.
So other than ADHD, what are the other neurodevelopmental disorders that may affect a child, his childhood, his school performance, and maybe even his future?
The causes for ADHD as a neurodevelopmental disorder, as I said, the neurological system doesn't develop adequately. And the development of this connectivity does not happen adequately, and therefore neurodevelopment disorders are all the same. They are connected differently, they manifest differently. So there are genetic causes, therefore. There are neurobiological reasons. That is the development of the brain cells themselves. There are neurobiological reasons why these cells don't function adequately. So those are the two major developmental causes. And the same causes are true for learning disorders. They are true for learning disorders or dyslexia, as generally used to be called. Learning disorders, communication disorders of speech and language. Motor coordination disorders where you button your shirt or lace your shoes. So these are all together. And autism in a big way. So
that is like an extreme end of neurodevelopmental disorder.
That is all these developmental disorders which share the etiology, the causes. So if we look at them, that cause makes it a spectrum. These are common underpinnings that you would see. And therefore, when you look at the causes, the symptoms are also interlinked. So you asked me about other disorders which are connected. In learning disorders, what happens is the area of the brain which is given the function of reading and learning, reading and comprehending, reading and understanding. The area of the brain which is given the function of writing what you know in your head. The area of the brain which understands digits and calculations and computations. All these areas are not functional adequately. So therefore, just like the neurodevelopmental disorder of ADHD, these particular areas do not function adequately. And therefore, there is a link that is there between learning disorder and ADHD.
Like that child who was in Tare Zameen Par.
Absolutely, like the child who was in Tare Zameen Par. The child had a lot of difficulties in reading and writing. You know, he couldn't understand.
Yeah,
he was literally word blind. ADHD is connected to learning disorders in a great way. In our Cochin experience, we find that 60 to 65% of children who have learning disorders, they do have a concurrent presence of ADHD.
Okay.
So it's not only that they are unable to comprehend what they read, they are also unable to sustain attention to the reading task. So both put together, these children are in trouble.
Get left behind.
And communication disorder is another thing that's very commonly seen. They are unable to communicate at the level at which they should be communicating. So the peer group interaction becomes less. They seem to get isolated very often. And there is a difficulty with language itself.
Yes.
They are unable to actually express themselves, the answers that they have in their head, the ideas that they have in their head, and which is a sad thing.
What do you tell the parents of these children?
We actually talk to them that these are not things deliberately done by these children. One of the major reasons why these children are brought is this fellow is obstinate, he is really unwilling to study, he can sit and watch TV for any amount of time, he sits with the computer for any amount of time, he is on the video game all the time, but he has no time for studies.
Yes.
But that is because the poor child does not have the function which he can use to study.
Right.
That is something that we should understand. So if the child cannot learn the way the child is taught in the class, we have to teach him the way he can learn in the class.
Right.
There is a reason for us to actually look at all these things together. Because if you treat one, there is amelioration or improvement of the other.
Okay.
What is happening now is ADHD is put into one category, it is put in one basket, and all the rest are removed from this.
Oh.
Parents do this, teachers do this, therapists do this all over the world.
Okay.
DSM, the Diagnostic and Statistical Manual that is used by American psychiatry to diagnose psychiatric disorders, that gives us the symptoms. This is a diagnostic manual. Using the symptoms listed there, you can make a diagnosis.
True.
And when you make that diagnosis, there is also a part of it called comorbidity.
Yes.
You should also look at what coexists with this.
True.
So unless you treat the coexisting disorders, which are all linked, as I said, there are underpinnings, these are all linked commonly together in terms of genetics, in terms of molecular biology, in terms of the symptoms of phenomenology, in terms of the response to intervention. They respond to intervention. And if ADHD responds to intervention, the learning disorder also improves.
Oh, okay.
If the learning disorder and the ADHD improve, then there is improvement in their behavior.
Yes.
There is a very interesting thing that we need to understand about ADHD and these children's behavior. They're looked upon as bad children.
Yes.
They are not bad children. They are such lovely children, provided we are able to take this negative part out of them. And that is where we need to intervene. If we look at children who have ADHD, and if we look at what happens to them as they grow up, because of the frustration of not being understood by their peer group, because not being understood by the parents and the teachers,
family,
and being put down all the time as bad children, they go on to develop to be oppositional.
Yes.
They object to what you say. They become defiant. You tell them something, ask them to do something, they will do the opposite. So there is a lot of oppositional defiant behavior that will come through them.
Yes.
And then they are punished.
Yes.
They are either physically punished or morally isolated. And then after this, they become worse. When they become worse, they go on to criminality.
Okay.
There is delinquency that many of them develop. And as they grow older, into early adulthood, some of them may take on to criminality. So the early intervention is where all this matters.
So diagnosis and treatment at the right time is critical for these children.
Absolutely. That's why we went through the diagnostic features, we went through the symptoms that these children have, and now it's important to recognize that these children should be treated early. What many parents do is, when the teacher tells them this child has got probably hyperactivity, you get a consultation, most parents become very hostile. Because many parents are very defensive. So many teachers, they tend to overlook this, which is the other side. They say all children are like this. All children are not like this. They can identify, but still they don't want to take on that responsibility. That is why it's important that teachers listen to discussions like this.
Yes,
Parents
they need to be sensitized.
They need sensitized
yeah,
to take these children for consultations early enough.
and if this is becoming such a common problem, then both teachers, school administration, everybody should also be got into the loop and, trained to look out for such
Especially
children.
teachers, because these days parents don't have much time
They
with the
don't.
children. The teachers who can look at children who stand out from the rest,
Yes.
and they can easily identify. I keep saying, there is a teacher in every school who can actually give a lifeline to this child for his future.
Sure.
One teacher, therefore, on the other side, is enough to destroy a child's life completely by being punitive, by punishing the child. So basically, we need to look at the remedial measures.
So, sir, today, in the Western countries, advanced medication which is being used to treat these children, are those available in India?
Oh, yes. India is not as bad as generally the world thinks it is.
Okay.
The cardinal management is actually medication.
Oh, I see.
Because as I said, we have moved on from the time when this is considered as an emotional disorder or a behavior disorder to today it being a brain disorder.
Brain disorder.
So we have moved on from a lot of haziness to a focus.
Clarity and focus.
There are medications, and that is central to the treatment. And the central part of medications we should understand are not just to control the symptoms of hyperactivity. That's what many parents think, that's what many teachers think.
Calm them down.
To calm them down. It is not so at all.
Oh.
This is about controlling what is called central executive functions.
Okay.
Which involve every one of these behavior and the child's metacognition, the ability to understand things. So the child, there is an overall improvement in the child that you will see.
All right.
So it is not just to control one hyperactive symptom that we give this.
Right.
It is for a whole lot of symptoms which control the child's behavior as well as child's learning process.
True.
And two, we also have other methods, other modes of treatment, which are the therapies that people talk about.
Okay.
But before that, there is something that I always emphasize, and that is the environment. The child needs an environment that is under control.
Okay.
So we have a need for what is called limit setting.
All right.
This involves only discipline.
Yes.
No shouting, no yelling, no screaming, no pinching, no beating, no bribing, no bullying.
Okay.
In which case, how do you control these children? By the personal space that we keep between the child and the parent, between the child and the teacher. So unless you have this personal space, you cannot set limits for these children. They do not know where to stop, poor children.
Right.
You have to stop them where they should stop and sustain attention to an ongoing learning task or a teaching task.
Okay.
And that is the major
crux of the therapy.
So if we are looking at how we do it in Cochin, we have a 5-finger approach. We have my thumb, which is discipline.
Okay.
The limit setting.
Okay.
Good parenting. Judicious, non-permissive, judicious parenting.
Okay.
And that within that parenting also would come the teacher.
Absolutely. The whole
thing.
Teaching.
All parenting authorities come under the same rubric.
Yeah.
Now, second is psychopharmacology.
Yes.
Pharmacological methods. That is using the medications. There are medications that are available, which are available since the past 50 years in the West. It's available here in India for the past 20 years.
So they're safe?
They are safe. The side effects are marginal.
Okay.
But of course, with therapies that are accorded to patients, children with ADHD, what are the myths that are spread by a lot of therapists, a lot of NGOs, that these medications make children sleep, they become zombies, that this produces problems with the mind, that these are harmful for the kidneys, that these medications are addictive. There are so many myths that are spread about this. But under the hands of somebody who is trained, it is very important that somebody who is trained, who understands the dosages, who understands the duration, the mode of administration, under the hands of somebody who is trained for this, an expert who is trained for this.
Yes.
Now instead what is happening is now everybody seems to be treating ADHD. So the cases of ADHD, children with ADHD are taken to non-psychiatric specialists.
Yes.
Where they are not in a position to talk about the type of therapies that should be administered. So what do? They send them off. They don't want to send them back to the psychiatrist because of the stigma, maybe.
Oh, yes, of course.
But they are sent to psychologists and education psychologists and speech therapists and language pathologists and all sorts of therapists.
Who don't understand the entire
neurobiological mechanisms.
No.
It's based on a lot of research. The National Institute of Mental Health, which is a temple of psychiatric research in the United States.
Yes.
NIMS conducted a study, the MTA study.
Yes.
The multimodal therapy for attention deficit hyperactivity disorder. And that study clearly showed the superiority of medications above any other form of therapy, including behavior therapy.
Oh, really? Okay.
So we should be very careful when you actually take the medication part out of therapies for fear of the side effects of the medication.
Yes,
as I said
that's
before,
why I asked you, because with children, parents want to...
Absolutely. Paradigm has shifted. And the shifted paradigm will offer you enormous opportunities for these children to get on to their right brain skills. What are the right brain skills? As I said before, other than reading, writing, arithmetic and language, music, art, painting, dancing, acting, using technology.
Yes.
Computer, mobile or remote facing, the 2-year-old children do that now. Unlike the generations before.
Oh, yes, very true.
Or naturalistic intelligence, doing things in the nature, farming or sports or games, directional skills, all these give you opportunities for a vocation.
Yes.
In a child with ADHD, if you can find which of these right brain skills this child has, you are able to actually pick him up, give him a training for a vocation that will make him joyful in what he is doing, because that is naturally given as a talent in his head by the Lord.
Yes.
And he can actually not only enjoy his work, but he will never get burnout. He can stand on his own feet, making an earning, and get on with life to a bright future.
How wonderful, Dr. Philip John. Thank you so much for being here and for telling us about ADHD and educating the people who see, so that we can spread more awareness about this within our society. Thank you so much.
Thank you very much indeed.